Want to build $1 billion company? Start by solving a problem everyone hates but no one fixes. Forget flying cars. Real opportunity is in the broken, boring stuff. Enter Todd and Ed Park, not your average startup founders. Todd built Athena Health. Ed was the US CTO under Obama. They know healthcare inside out and saw a disaster in senior care. Medicare for seniors, confusing, impersonal, and full of red tape. Imagine your grandparents lost in paperwork, surprise bills, and doctors who never talk to each other. Todd and Ed saw not just a business opportunity, but a moral one. Their question, what if healthcare treated every member like family? That idea became Devoted Health. They didn't just want a better app, they wanted to rebuild the whole experience. Their big idea? Make seniors feel cared for, not just processed. Investors loved it. This wasn't chasing trends. It was fixing a massive, painful problem. The Park brothers spent years learning the system's flaws. They knew the pain points, the rules, and the players. Their plan was ambitious, but grounded in real expertise. They weren't selling a dream. They had a blueprint. Lesson 1. Solve a problem you know better than anyone else. Don't chase hype. Chase real problems. That's how you build something that matters and makes money. The best ideas are hiding in plain sight. Devoted Health is proof. Let's talk about the real problem. Devoted is solving senior healthcare is a nightmare. Seniors on Medicare face endless confusion, finding doctors, dealing with paperwork, and managing care alone. Your grandma gets sick, calls around for a doctor, waits weeks, then has to repeat the process for a specialist. No one coordinates her care. She's her own project manager. Doctors, specialists, pharmacies, and insurers don't talk to each other. One missed detail, it's a disaster. The result, worse health, redundant tests, and constant stress. Customer service, forget it. Endless hold times, unhelpful scripts, and zero empathy. Seniors feel like numbers, not people. Devoted Health zeroed in on this emotional pain point, feeling lost and alone. The problem is both logistical and emotional. Fragmented care leads to bad outcomes. Lack of empathy makes it worse. Devoted's insight, you can't just build a better insurance plan, you need a better service. Combine tech, data, and real human kindness. That's how you fix both the system and the experience. Seniors deserve more than a policy. They deserve a team. Devoted Health set out to deliver exactly that. It's not just about coverage, it's about care. That's the difference. So what did Devoted Health actually build? Not just another insurance plan. They built a full stack solution, controlling everything from insurance to service. Their secret weapon, the Devoted Guide. Every member gets a dedicated guide, a real person who knows their story and handles everything. Need a doctor? Confused by a bill? Call your guide. No more call center runarounds, just one trusted contact. Behind the scenes, Devoted's custom software, Orinoco, gives guides a 360-degree view of each member's health. It pulls in data from doctors, labs, and pharmacies, so nothing falls through the cracks. If a member misses a prescription, their guide calls to check in. This is proactive, not reactive healthcare. Devoted even has its own medical team, doctors and nurses who do telehealth and house calls. Yes, real house calls. By owning the tech, service and care, Devoted creates a seamless experience. They're not just selling insurance, they're selling peace of mind. It's a new category, healthcare that actually cares. For seniors, that's a game changer. For the industry, it's a wake-up call. That's how you stand out. How does Devoted deliver on its promise? 3 words: technology, team, trust. First, technology. Orinoco isn't just a database, it's an intelligence engine. It flags issues, automates tasks, and helps guides spot gaps in care. For example, it reminds guides when a diabetic member needs an eye exam. Second, the team. Devoted hires and trains guides to be empathetic problem solvers, not just call center reps. Guides work closely with nurses and doctors, so answers come fast, not in days. The culture, treat every member like family. Third, trust. Devoted is proactive, welcoming new members, reminding them about appointments, and checking in after hospital stays. Every positive interaction builds trust. That's their moat, a reputation for actually helping. By controlling insurance, service and tech, Devoted eliminates friction. Think Apple hardware, software and service all work together. Devoted is doing the same for senior healthcare. It's complex and expensive, but it's how you win for decades. Integration is their superpower. That's the playbook. Let's talk money. Devoted's vision needs serious capital. The Park brothers didn't just raise a seed round, they raised over $2 billion from top investors like Andreessen Horowitz and General Catalyst. That's one of the biggest war chests in digital health history. Why so much? Building an insurance company is expensive. You need cash reserves for claims, custom tech, and a national team. After their last round, Devoted was valued at $12.7 billion, a decacorn. The Medicare Advantage market is massive. Even a small slice is worth billions. The valuation is a bet on their ability to scale and win. Running insurance is capital intensive. Regulations require huge reserves. Plus, marketing and hiring guides and clinicians isn't cheap. The $2 billion isn't just for growth, it's the price of entry. Devoted is playing a high-stakes game. And they came prepared. Investors believe in the team, the model, and the market. That's why the money keeps coming. Big vision, big backing. Valuation is potential, revenue is reality. Devoted Health's growth is explosive, $2.5 billion in revenue in 2023, up from $1.2 billion the year before. That's doubling at massive scale. Membership hit 140,000 in early 2024, still a fraction of the market, but growing fast. Their model is attracting seniors and taking share from giants. Revenue per member is high. Medicare pays a fixed amount per enrollee. The formula: more members, more revenue. But here's the catch, they're not profitable yet. Losses are in the hundreds of millions, but that's the VC playbook. Blitz scale now, profit later. The bet, their high-touch model will lead to healthier members and lower costs over time. The key metric is medical loss ratio. Spending less on care means more profit. If Devoted keeps members healthier, they win. For now, investors are happy to fund growth. They're buying market share today, betting on profits tomorrow. It's a long-term game. Devoted Health isn't alone. They're up against giants like United Healthcare and Humana. The big guys have millions of members and deep pockets. Devoted's edge, member experience and service, not just network size. On Trustpilot, United Healthcare scores around 1.2 out of 5. Reviews are brutal. Denied claims, bad service, endless phone trees. Devoted's reviews, though fewer, are glowing. Members rave about their guides and personal care. Words like caring and life-changing come up again and again. This is Devoted's secret weapon: happy customers who spread the word. In the senior community, word of mouth is everything. When grandma loves her plan, everyone hears about it. The big incumbents can't easily copy Devoted's high-touch model. It would require a total overhaul. Devoted built it right from the start. Their advantage is cultural and technological. They're creating loyal advocates, not just policyholders. That's how you disrupt a market. The giants are stuck. Devoted is moving fast. What's the big lesson from Devoted Health? Find a massive broken industry with terrible service and fix it. Don't invent a new market. Invade an old one and do it better. Devoted didn't invent health insurance. They just made it work for seniors. They focused on one painful problem and went all in on the solution. They rebuilt the service model around the customer, not the company. Technology plus real human care. That's their unbeatable offer. Vertical integration is their moat. Own the insurance, the tech, and the service. Most startups do one thing. Devoted does three, seamlessly. It's bold, expensive, and hard to copy. They're playing chess while others play checkers. So ask yourself, what giant broken industry can you fix? Build a service people rave about. Combine tech and a human touch. Devoted is on its way to $100 billion, and not by inventing flying cars, but by treating people like family. That's the billion-dollar lesson. Go find your problem to solve.